Hey everyone, Jimmy Davis here, host of the Moderate Podcast, coming out every Sunday with a new episode. So hopefully you'll check us out. Our website is themoderatepodcast.com. If you would do us a favor and subscribe to our YouTube channel, just hit the subscribe button below, and you'll be able to get all of our latest on YouTube. But again, we are mainly a podcast, so I hope that you'll check us out there. So what I wanted to do today was go through some numbers related to the coronavirus and deaths in 2020 because, and it's just the numbers. And I do have a couple of articles at the end that I want to share with you, but I hope that this is going to be a good analysis for people to look at numbers. I'll leave all the links of all my sources in the description below, so check that out. But I encourage you to make this a thought-provoking exercise. I want people to go out, explore the data, get more information, and to come to your conclusions. Because there are some things that I have an idea of why the trends are the way they are. But I want to hear in the comments below what people believe are the root causes of what we're seeing. If it is coronavirus, if it's something besides the coronavirus, or a combination of the two. And I want it to become kind of and show your conclusions with evidence. Show your conclusions with actual links that make sense. Okay, so that's what I want to try to do on today's program. So I wanted to show you a chart that it's a cautionary tale, and this was presented in the state of Kansas to show about the effects of masks and where masks are being worn versus where they're not being worn. And I want you to pay close attention to a particular thing here. You notice the red line is counties that have masks. This is daily cases per 100,000 of population. And so in Kansas, it's not a statewide mandate. It's a county-by-county decision. So there are counties that require masks and counties that don't require masks. So you see this red line and it's required mask, and you see, oh, look, the number goes lower. And the blue line still kind of stays consistent. So it may look like masks help. And maybe they did in the mask counties, except for one thing. This is where you got to be careful. You notice where you have two y-axes. So you have a primary axis and a secondary axis. And what that usually is used to do is to show proportionality from two completely different scales when you're not comparing the same type of things. But both of these scales are talking about cases per 100,000 population. In that case, it is not good policy. It is not good statistical analysis to use a different axis. Because look at this. You see that the axis goes from 15 to 25 here, and it goes to 4 to 14 for no masks. So even though it looks like, oh, look at this, mask counties have less cases than no mask counties, except for the fact that if you look at the scale for no masks, the number is about 9. If you look at the scale for mask counties, the number is about 16. So which one's more? Actually, it's the mask counties that have 16, and the ones with no masks have 9. So if you're not paying attention, you may think that the counties with no mask mandates have a higher case number than the ones that have mask mandates. But that is now that I've explained to that, you can see that's not the case. So I want to make sure that people are wary of those type of things, and that my data is not going to do that kind of thing as I go through it today. So we're going to go through total deaths through week 30. That's pretty much looks like where we have pretty good solid numbers, even though it's 3 weeks past that. But of course, there may be, there's delays in reporting and things like that. But the numbers start to look pretty solid about that point. So I grabbed these numbers earlier this week. We're going to look at deaths by age group. We're going to review flu trends over the past 5 years, and then review deaths in 2020 versus average of past 5 years, and then how COVID data compares to excess deaths, and what do hospitalizations look like. And then how did we How did the excess death numbers develop? Looking at it by week and breaking it down a little bit that way. Again, to paint this picture about what is actually going on. And again, it's up to you, and I want to hear from you as to what these numbers actually mean. Okay? So let's get into it. So the number of deaths over the last 5 years through week 30 of any given year is about 1.6, a little over 1.6 million, 1,629,000. This year, through that same time period, so through the week of July 25th, the number of deaths is 1,877,000, an increase of about 248,000. Okay. Now, let's break that down by age. And I show the line here, and again, I use the secondary axis here. This is number of deaths. This is percentage of population. And that's what the line corresponds to. I wanted to show the proportion of population for each of these groups, and then the number of deaths in each of these groups. And you can see that in 85 and over, that's where our most deaths are, which would make sense because people tend, in rare cases, do people not live to their quote-unquote age expectancy, and therefore you would expect the highest number of deaths would be in that largest range. And our smallest one is in the under 25 category. The only kind of exception to that, at least in average deaths, if you look at 45 to 64 to 65 to 74, it's a little bit less because this group has far lower populations. You kind of get a little more granular once you get past 65 here in terms of how we look at things. We look at under 25 and then an age range of 20 years, another age range of 20 years, and then we go to 10 and 10, and then anybody over 85 and over. So you can see that in almost every case, the number of deaths is up, which would make sense when you're in a pandemic. We would expect to see that. But are those numbers going to correlate to just the coronavirus? That's what we're going to look at later on. But you'll notice under 25, it's actually a little bit of a dip right here. You see that? So again, it's something to just ponder on, contemplate as we go forward. But one that a couple of age groups that are a little bit of an anomaly are 25 to 44 and 65 to 74, as you're going to see when we go through this data. I wanted to kind of paint the picture of the flu. So we have the flu season every year, and some people have said this is just a bad flu, and in a sense, maybe that's true. But once you look at the data, you can see that that's really probably not the case. So, and I just did this for scale. You can see the number of flu cases, and the age ranges are a little bit different. The way they present this is 0 to 17, 18 to 49, 50 to 64, and then 65 and over. So you can see that 65 and over have the most cases of the flu. But and then you can see the number of flu hospitalizations and flu deaths, and this is the average of the 2014-15 to 2018-19 flu seasons, because the 19-20 numbers are still not complete. So the average of those 5 years. So we're using 5-year averages. And so you can see how the cases break out. And then you can see number of hospitalizations is almost flat. Number of flus, you can barely see a line there. So we're going to take the number of cases out and look at hospitalizations versus deaths. And you can see even in this case that the number of deaths is very, very small compared to the number of hospitalizations. And you can see overall it's about a little over 500,000 in an average year that are hospitalized due to the flu. And that's an important number. That's going to be something very important as we look forward to this. Keep that number in mind because we're going to look at the number of COVID hospitalizations, or at least COVID-related hospitalizations, according to the CDC. And again, this is all information directly from the CDC, and I just kind of, put it into Excel and to ran graphs as a result of that information. So now let's just look at the deaths, because that is a big deal, because when we're looking at how we react to a flu season versus how we react to COVID, part of it is because hospitalizations and deaths. That's why this number, this hospitalizations number is an important number, as is the number of deaths. Because if COVID causes the same number of deaths as flu, then all of the stuff that we're doing is not necessary. And some people have said that, but as you're going to see, that isn't the case. Our biggest group of deaths, again, 65 and over, 34,000 on average per year. Okay. Now, I'm going to back up real quick. We're going to look at total deaths again. So far this year, almost 570,000 people 85 and over have died. On a normal year, about 510,000 would die in any given year. So it's not like people don't die. People die all the time. You can see that, again, in an average year through the end of July, essentially, over 1.6 million people have already died. So when we're talking about the number of corona deaths that we have seen, relative to the total number of people that die on an annual basis anyway, maybe that number isn't as big as it sounds. Or maybe it is. Depends on how you look at it. I'm just trying to give you the numbers here. Now, let's look at the 2020 flu season, because we still had the flu this year, believe it or not. You can see the number of illnesses between 39 and 56 million, medical visits about 18 to 26 million, hospitalizations somewhere between 410 and 740,000, and about 24,000 to 62,000 deaths. So, in other words, a relatively average flu season. And this kind of shows it right here, because you can see the total hospitalizations at the end of past flu seasons, and it looks like this year's pretty much right there in the middle. And it's through the beginning of April. And the reason that you have that is because that's usually about when the flu season has kind of run its course. And that's why there were people that thought that the coronavirus pandemic would kind of die out around that time too, because that is what typically happens with the flu. Now, again, comparing the number of deaths we had this year to the coronavirus, basically this number of deaths is the number that are attributed to coronavirus. But remember, I said that there were 248,000 excess deaths. So that leaves about 100,000 that are that have not been connected to the coronavirus, at least not yet. Or maybe they aren't connected to the coronavirus. You see what I'm saying? We don't know that. And there's still more analysis and more data that has to be analyzed in order to be able to get a more accurate number. But a lot of what we've heard is that the number of corona deaths has been overblown, either through fraud, through conspiracies, or just the way that they're counted for CDC purposes. But yet, we have almost 250,000 deaths more than we would have in an average year. And yet, we only have, at least as of July 25th, only 145,871 coronavirus deaths. So I find it hard to imagine that the number of coronavirus deaths is overstated, okay? Because you still have 100,000 that aren't accounted for in the coronavirus. And deaths are deaths. The number of deaths are the number of deaths. So it kind of takes the bias out of it about, the cause of death and is the reporting correct. Either someone died or they didn't. And so the number of deaths reported is probably almost an indisputable number, which is why it's a good metric to look at relative to other years. So the 250,000 deaths extra that we've seen so far this year is a telling number. Okay, so let's look at COVID deaths by age range. And again, we've talked about this. The number of deaths for the flu in an average year is about 450 for 18 and under. For 25 and under, we've only had 287 coronavirus deaths. So, and again, remember, there were actually less deaths so far this year in the under 25 category than there have been in the average of the last 5 years. So it's not like those numbers have bumped up. Where we start to see a little bit of a discrepancy is in the higher numbers. You can see 65 and over. So basically, these three bars combined, well over 100,000 here. You probably let me do the quick math here. Looks like about 100 and maybe 104,000 deaths. 30, 38, and 46. 46 and 38. That's about 74 plus 30 is about 104. So maybe 104 with rounding 105,000 deaths, 65 and over. Normally you'd have about 34,000 attributed to the flu. So a significant number higher. And that makes sense because one of the things we have heard is that the number of people that die from the people that die from coronavirus tend to be older, and they are more susceptible to it. Another category is the 45 and 64 age range, even at 25,000. That's significantly higher than what we see with the flu. So this is certainly not the flu. I think you can dig just by the numbers. And again, it seems as though that there's a very weak argument to say that the number of coronavirus deaths is overstated based on the overall number of deaths we have seen, especially when you look at each of these age categories comparatively, because that's what we're going to do in the next slide. You can see the number of deaths, overall deaths, right? And we said that almost all these categories are up except for this one. You can see that there's, tragic, always tragic to have somebody under 25 die. 35,382 here, but only 287 of those are related to the coronavirus. But even in the 85 and over category, less than 10% of people died as a result of COVID-19 in that category relative to everybody that died. So, I think that's something to keep in mind. So now let's look at COVID deaths versus excess deaths. 145,871 COVID deaths versus 248,000 excess deaths. Again, so that's that difference I was talking about. 103,000 deaths that are not accounted for with COVID-19 that are over and above the average that we would see here. Now, maybe it goes up every year a little bit because of population growth, but also life expectancies get longer. So there's not a huge difference between the number of deaths between 1 year and the next. It usually stays pretty darn consistent. It grows very, very little, maybe 1 or 2%. 250,000 is about 15% higher than the average based on the numbers. So it's about 15% higher than you would see in a typical year, or at least over the last 5 years. It's a 15% increase. So let's now look at the coronavirus next to each of these. And so this is what I was talking about. Many of the excess deaths in the 85 and over category can be attributed to coronavirus. Where you start to see a big discrepancy is in the 65 to 74 range. Even somewhat here in the 75 to 84 range. But the one that really alarms me more than anything else is this one, the 25 to 44 category. Only about 21% of the deaths, excess deaths, can be attributed to COVID-19, at least by this data. Now, does that mean the number of COVID deaths in that category are understated, or does it mean that there's other things going on? And so once we look at things week by week and we know kind of the pattern of what we've seen in cases and in outbreaks, especially the outbreak in New York City in the Northeast, that's going to be something that we're going to have to look closely at. And you're going to be able to see that on the graph because this is nationwide data. If you break it down by states, which, by the way, the place that I got this data from will break that down for you. You'll be able to see how much it is by each state. And you can break it down by age group as well. And there's other tools you can do on that website as well. So that link is in the show description. So make sure you check that out. So let's look at hospitalizations. Remember, 500,000 hospitalizations, roughly a little bit more than that per year for the flu. For the coronavirus, so far, COVID-19 laboratory confirmed hospitalizations. The total number through August 8th, actually beyond what we've looked at here, is at almost 47,000. almost 19,000 of that, 65 and over. 18 to 49, 13,000. Under 18, what is that, about 700 or so. Close to 700, 650, 655 to be exact here. So again, not nearly at the levels of the flu, but yet we see more deaths as a result of that. Now, does that mean that there are more cases out there than we think? And that's probably true. I mean, there's probably people that got sick and aren't getting tested. I mean, let's be real. And there's also people that are asymptomatic that probably have carried the virus and didn't know it where they were asymptomatic, because that's how something like this can spread. I mean, even if every single person that got sick stayed home, followed the proper protocols, and basically self-quarantined like they're supposed to, it doesn't mean that we're going to stop this thing, because again, it has to do with that asymptomatic carriers, and that would make sense and it would probably prove that theory correct, that the spread continues to happen even if people are using that philosophy. Now, is everybody doing that? Probably not, and it probably contributes to the problem. But for the most part, I think people are, if they are sick right now, they're staying home when maybe before they work through it, because I know a lot of people that work through it. And to be honest with you, I'm guilty of that myself. So let's look at weekly excess deaths by age. And this is where I was talking about, where you can see the spike. You see this spike come in starting on the week of April 11th to April 18th. This is when everything was really bad in New York City. And the average time, the time varies from when you get this thing to when you die from it, if you die from it. It's anywhere from 2 to 8 weeks. So you can probably believe that a lot of the infections happened right around the time, right before the lockdowns kicked in. Because also there's some time to take that for this reporting as well. So there's lag time with reporting, plus there's lag time of contracting the virus to dying from it. It's not like you die overnight from this thing. You catch it, and next day you're dead. It takes time to manifest itself. It takes time to grow the symptoms and ultimately, lead to the pneumonia and complications that could lead to death. So again, you have these spikes, and you can see where the spikes are, though. You see the spikes. The light blue line here is under 25. Relatively little change from historic average, from the 5-year average. 25 to 44, though, is an interesting one. Unlike these other age groups that peaked and then dropped, the number of deaths for 25 to 44 have remained steady. And that is I'm in that category, so maybe that's why it's concerning me. But this is very concerning for several reasons, because to me, this indicates there's something else going on besides COVID-19. And we'll get into that in a moment. But as you can see, for each individual age range after that, 45 to 64, 65 to 74, 75 to 84, 85 and over, you can see it increases at each band. And again, that goes to that theory again, that this disproportionately affects older people, just like the flu does. 75% of flu deaths are people 65 and over. Something to keep in mind. So let's look at this from a percentage basis, a weekly percentage of excess death. And you can see the biggest group here now is 65 to 74, over a 50% increase over this week, over the last 5 years. So this is basically looking at this particular week and comparing it to what percentage increase in deaths happened in that particular week compared to that same week in the previous the average of the past 5 years. Okay, hopefully that makes sense. You can see the blue line consistently just right at or below the number, especially in here. Lockdown, right? Maybe the lockdown actually contributed to young people that would maybe otherwise have died from various ailments and injuries and things like that, weren't exposed to those things, and therefore that's why the excess death with death was actually down for this population. And again, the orange line is the one that concerns me the most, because the gray line, the yellow line, the blue line, the dark blue line, and the green line are kind of doing the same thing they did here. And you see this little spike here. I'm not too worried about that. We're going to go over why that is in a moment. But this orange line starts to kind of lags a little bit, but then it doesn't drop off after these start to drop off. But what's happening here? Continued lockdown. Almost everybody in this age range is working. They've got families. This is where you start your families. You have young families in this category. The people in this silver line are a little more established in their careers, which is maybe they don't have the insecurities, the economic insecurities that this group has. So this could be domestic violence. This could be suicide. This could be drug overdoses, things like that. Those are the things that maybe are the collateral damage that have happened as a result of the lockdowns in order to try to quench the virus. Now, did the lockdowns help contribute to these numbers coming down? Perhaps. But that's up to you to tell me. I want you guys to do that. I've done some of the work. I don't want to do all the work on this thing. You know what I'm saying? But let's look at it by each category. Again, the blue line is the baseline number, and the orange line is here. And you can notice that the numbers actually, on average, go up a little bit during the summer months, interestingly enough, right? Whereas when you go to 25 to 44, again, this is where it's concerning, because you can see the number has been diverged from the average even before the pandemic started. So something was going on with this age group before any of this. Is it economic based? I don't know, but something was going on here that I want more information on. But you can see even the spike in the pandemic, the closures happen, and it doesn't subside. It doesn't subside like it does with other groups, as you're going to see. You start to see the 45-64 was following along pretty much a normal year. Pandemic hits, boom, you see a spike, and then starts to come back down again. There's still a difference here, but it comes down. 65 to 74, even more pronounced. They had a little bit of an issue here even before the pandemic. So maybe there's something to look at there as well. When you look at these numbers between 10 and 12,000, it's not a big percentage increase, but you do see the spike here. And this does make sense that it's related to coronavirus. But then you start to see it kind of subside, and you kind of see this bump up here. But you can see also a phenomenon that you're going to see even more pronounced in 75 to 84 and 85 and over is that the number kind of starts up high during the year and goes down over time as we get out of flu season, because the ailments that kill older generation tend to happen in the wintertime, which is why you have the snowbirds, because it actually is better for their health to be in a warmer weather, which is why a lot of retired people that live in the Northeast will go to Florida. They will go to Arizona, California during the summer, or during the winter, to escape those cold winters, because it kills them. It literally kills them, as you can see from these numbers. And it's even more pronounced in 75 to 84. You can see this number slowly decline throughout the year. And you can see the spike here, and it starts to come down. And you see a little bump up too. Remember, we saw the percentage a little more pronounced, but the reason is because this blue number continues to drop over time as the year goes on. And you'll see this number start to spike up again in the fall, when the flu season usually starts. That number will start kind of creeping up back to this level right here. 85 and over. That's even more pronounced. They actually were doing great the first few months of the year, a little bit down there. And then you see the big spike up, and then you see it start to drop off again, and you start to see it tail up a little bit again. Not a lot, though. Not a lot. So, are there answers to all of this stuff? Well, there are, and it's interesting to look at. I have 3 articles to go through with you. First, an article from the University of Minnesota talking about a research done by Yale University. The headline on here probably can give you an idea of where they're going with this. About 30% of COVID deaths may not be classified as such. So basically, what they're trying to say is that all these excess deaths are attributed to should be attributed to COVID, and I have a hard time believing that, especially when you look at the age breakdowns. Okay, from March 1st to May 30th, there were about 781,000 all-cause deaths in 48 states, 95,235 officially attributed to COVID-19, leaving 122,300 more than would be expected during that period. The researchers said that although they can't classify the deaths as due to COVID, flu activity had fallen to historically low levels in March. So apparently, does the coronavirus kill the flu bug? I'm not sure. Here's an example. In New York City, all-cause deaths were 7 times higher than baseline at the pandemic peak, with 25,100 excess deaths, which, again, shows you how much New York City contributed to this, of which 26% were not attributed to COVID-19. In other parts of New York, excess deaths were only twice as high as the baseline, with 12,300 excess deaths. Other states with high numbers of excess deaths were New Jersey, Massachusetts, Louisiana, Illinois, and Michigan. While there were fewer no excess deaths reported in smaller central states and northern New England. The gaps were even wider in Texas, with 55% of excess deaths not classified as due to the coronavirus. And in Arizona, where 53% of excess deaths were attributed to causes other than COVID-19. Minnesota showed the best agreement. They said best. Not most, best. And that does paint a huge amount of bias in here to me. Minnesota showed the best agreement, with only 12% of excess deaths unattributed to COVID-19. So they're working from the assumption that all of these deaths are related to COVID-19. Okay, then they kind of back out of that a little bit with some of the things they're talking about. The differences could be the result of guidelines on the recording of deaths that are suspected but not confirmed due to COVID-19 and the location of death. For example, nursing home deaths may be more likely to be correctly attributed to the coronavirus because they have a higher chance of being recognized as part of the epidemic, which is true. About 77% of the excess deaths were, or I guess the way I should say it is 77% of the excess deaths are could be related to COVID-19, I guess is the way to say it. The author noted that in the early part of the pandemic, when diagnostic tests were in especially short supply, only about 10 to 15% of all coronavirus infections were diagnosed. These findings demonstrate that estimates of the death toll of COVID-19 based on excess all-cause mortality may be more reliable than those relying on only on reported deaths, particularly in places that lack widespread testing. So again, it goes to the bias that that all excess deaths are 100% attributed to COVID-19. Now, the Washington Post has a really good write-up on this, which actually maybe points to something else. The coronavirus killed tens of thousands in the United States during the pandemic's first months, but it also left a lesser-known toll, thousands more deaths than would have been expected from heart disease and a handful of other medical conditions, according to an analysis of federal data by the Washington Post. The analysis suggests that in 5 hard-hit states and New York City, there were 8,300 more deaths from heart problems than would have been typical in March, April, and May, an increase of roughly 27% over historical averages. That spike contributed to Illinois, Massachusetts, Michigan, New Jersey, and New York State, and the city having a combined 75,000 excess deaths during that period, 17,000 more than the number of officially attributed to COVID-19. While experts said some of the excess deaths in the analysis were certainly unrecognized fatalities from COVID-19, the review suggests that many patients suffering from serious conditions died as a result of delaying or not seeking care as the outbreak progressed and swamped some hospitals. Normally, heart disease is the leading cause of death in the United States, but in the early months of the pandemic, some hospital departments were nearly devoid of the heart, cancer, stroke, and other patients who populated them before. The analysis of data from March 1st to May 30th using a model previously developed by the Yale School of Public Health showed heart disease is the major driver of excess deaths, including those officially attributed to COVID-19. The number of excess deaths in the United States during the pandemic far surpasses the number officially attributed to COVID-19. Analyses have shown. The official death counts from the disease are incomplete, according to experts, in part because it spread for weeks before testing was widely available, and because the virus kills in a variety of ways that were not recognized early on. But several experts said the spike in the cause of death in the new post-analysis suggested that a deadly collateral effect of the pandemic. They said the surge in deaths from heart disease and several other conditions matches what they saw in clinics and hospitals and confirms their fears that many patients died after not seeking care. New York City, which reports its COVID 19 statistics separately from the state, quickly became the epicenter of the pandemic in the United States and saw more than 4,700 excess deaths from heart disease, more than 4 times the number of any other jurisdiction. All those patients that would typically have been having cardiovascular care were not there. John Puskis, chairman of cardiovascular surgery at Mount Sinai Morningside Hospital in Manhattan, said, Those who would have had emergency life-saving care did not receive that care, and they then became one of the statistics on your chart. In many cases, experts said, patients suffered through cardiac events, strokes, hyperglycemia, and other health difficulties at home, likely fearful of seeking care in hospitals where a large number of people were suffering from COVID-19 were receiving treatment. Between March 15th and May 23rd, visits to hospital emergency departments declined 23% for heart attacks, 20% for strokes, and 10% for high blood sugar crises, a complication of diabetes, when compared to the previous 10 weeks, according to a report last month from the Centers of Disease Control and Prevention. The striking decline in ED visits for acute life-saving conditions might partially explain observed excess mortality not associated with COVID-19, the researchers wrote. On Wednesday, an article published in the Journal of the American Medical Association bolstered the findings from the Post and CDC analyses. The paper looked at excess deaths nationwide in March and April and found that 35% were attributed to causes other than COVID-19. The researchers, led by a team at Virginia Commonwealth University, concluded that those deaths may include unreported non-respiratory manifestations of the virus, or they could represent secondary pandemic mortality caused by disruptions in society that diminished or delayed access to health care. The head of the National Cancer Institute, Norm Sharpless, predicted on June 18th that delays in cancer screenings, diagnoses, and treatment during the pandemic are likely to result in thousands of excess cancer deaths in years to come. Some of the remaining excess deaths, especially early in the pandemic, were likely caused by COVID-19, but not attributed to the disease when death certificates were filled out by physicians, coroners, or medical examiners. Not everyone gets an autopsy. Everett Erickson, trauma medical director of the Medical University of South Carolina, one of the physicians who saw empty beds as the pandemic first hit. There is some miscoding that goes on there. That's why a lot of this is difficult to tie causation to. This one, again, coming from Yale, I think it's probably the same guy that led the study that I talked about before. Increases in deaths from pneumonia and influenza, for example, point clearly to missed cases of COVID-19, said Dan Weinberger, professor of epidemiology at the Yale School of Public Health, who led the team that developed the model the Post used in its analysis and co-wrote the JAMA paper. Wait a minute. Wait a second. Increases in deaths from pneumonia and influenza point clearly to missed cases of COVID-19? What? COVID-19 I thought was caused by coronavirus, not the flu virus. So how can you say that influenza is a case of COVID-19? I could see pneumonia. It could be a complication of having the coronavirus, absolutely. But influenza? That doesn't make any sense. Now, because tracking efforts show that influenza fell to undetectable levels in March, Weinberger said, the excess pneumonia and influenza deaths we're seeing are probably COVID-19 deaths that are just not being attributed to the virus. So maybe we just stopped counting the flu because we were so worried about the coronavirus. Maybe that's a possibility. I'm not seeing, maybe someone can explain that to me. I'm just not seeing that how that can be possible. But anyway, the post-analysis estimated there were more than 1,300 excess deaths from diabetes. The post-analyzed analysis also estimated there were 1,300 more deaths attributed to Alzheimer's disease that would have been than would have been expected, adding to the pandemic's devastating toll on the country's elderly. And as with other diseases, experts said some of those Alzheimer's deaths may have been missed cases of COVID-19. Possibly, it could have been complications due to the virus. Though COVID-19 was originally believed to be primarily a respiratory illness, Erickson noted that its ability to attack blood vessels and form blood clots. That virus-related complication could have created stroke symptoms in some patients, he said, but there almost certainly were patients who delayed stroke treatment out of fear of exposure to the virus. Analyzing death by cause underscores the severity of the pandemic, its cascading effects, and the deadliness of the novel coronavirus, Weinberger said. Or our reaction to said coronavirus maybe contributed to making it worse than it otherwise should have been. There's that possibility too. This Weinberger character, I just can't agree with that guy at all. But when I talked about the 25 to 44 age category that only had 21% of its excess deaths associated with COVID-19, or it was as a ratio, that leaves 78% from another cause. Here's what I'm going to wrap up with an article from CNN. New psychological data taken during the pandemic shows the nation's mental health is languishing, according to data reported this week as part of the U.S. CDC Morbidity and Mortality Weekly Report. Suicidal ideation is up among young people since last year, with as many as 1 in 4 people ages 18 to 24 having seriously considered suicide in the past 30 days. In the general U.S. population, the CDC reported that 11% of all adults surveyed had seriously considered suicide in the past 30 days before they completed the survey. The results reflect a nation increasingly on edge. The number of Americans reporting anxiety symptoms is 3 times the number at this same time last year, the CDC said. Previous events had a start, middle, and end, said Vale Wright, Senior Director of Healthcare Innovation for the American Psychological Association. People can't disconnect from this. Unlike events such as 9/11 or hurricanes, the coronavirus pandemic isn't just something people watch on the news, limited to a specific time and place. It's everywhere, and it doesn't appear to have an end date. Nobody is immune to the stress of the pandemic, Wright said. Add on the pressures of the economy, the increased scrutiny on racial injustice, and the looming specter of the presidential election, and it's hard for many people to feel like things might turn out okay. The emotional burden is falling more heavily on those who reported having been treated recently for mental or emotional issues, the CDC report stated. In particular, the stress is disproportionately falling on the young. And so my theory, and it's just a theory, is that the cause of the spikes in the 25 to 44 range, especially since it's such a small correlation to coronavirus, is that that mental health aspect, whether it's domestic violence, suicide, drug overdoses, those kind of things. That's what I fear. And it makes me ask the question, is a one-size-fits-all approach to closing things down necessary? Or do we need to maybe protect our older population while at the same time making sure that we don't sacrifice our younger generation in other ways? For a population that disproportionately dies more anyway. It's as hard as it is to say that. But we can protect the elderly. They don't have to go to work. They've got Social Security. They've got Medicare. Their economics are very different from the people that are working, that have young families. That's what we have to think about. So, I do want to thank you for joining me today. Again, Please check out all the links in the description. Please subscribe to our YouTube channel. Check out all of our social media. You see it here on the screen. Visit our website, themoderatepodcast.com, to subscribe to our podcast. We have a dozen platforms that we're on. We're going to have a new show every Sunday, so check that out. We're on Twitter, which is what I post on the most, at the Mod Podcast 1. We're on Facebook at facebook.com/themoderatepodcast, and we are on Instagram at the Moderate Podcast. So again, please leave comments. I want to see what your thoughts are on this. Share this with your friends and get their thoughts on it. Let's start a debate on this and really get to a good, honest place about where we are. I don't think it's a hoax. The numbers bear that out. But I also don't think that the way we've been treating this thing is a proportional response to what the true dangers are. Just what we've been seeing. But I want to hear your thoughts. So subscribe today, and we will see you on Sunday on our normal podcast on the Moderate Podcast. Thanks for listening.